It's important to realise that it doesn't need to be inhaled, so it gets absorbed through the skin.
Edinburgh's taxi drivers are often thought of as the eyes and ears of the city. They're now being offered the chance to help tackle the issue of drugs-related deaths by receiving training in how to administer the life-saving drug Naloxone.
Naloxone is a drug that temporarily reverses the effects of an opiate overdose, so essentially it does buy time, vital time, to keep that person alive. Essentially Naloxone starts breathing again, so it allows somebody to respiratory effort to restart, which buys time for the ambulance service to come along and intervene and provide medical care.
The training helps drivers to recognise the key signs of an opiate overdose, including being unresponsive or sleeping. They then receive their Naloxone pack in the post, which they'll keep in their cab. It can then be administered via injection or nasal spray. There are no dangers associated with giving the drug to someone who turns out not to have overdosed, but if they have, it can give vital time before an ambulance arrives.
I'd be confident enough with the training. The training is fairly easy to follow through. We're often referred to as a fourth emergency service in Edinburgh, and it's true. We see so much, and as I said, if there's anything we can do that can help people's lives, it's a great initiative.
Those involved in the training say normalising the use of Naloxone is an important part of reducing stigma around drug users.
People who use drugs are massively stigmatised and marginalised in our communities, unfortunately, and this can put them off asking for help. And I would just encourage people to think about how we sometimes treat people who use drugs.
The ambulance service is also urging everyone to take part in the 20-minute online training. It's hoped normalising the use of this life-saving treatment will go some way to help prevent as many drugs-related deaths in Scotland as possible. Vanessa Kennedy, STV News, Edinburgh.